Let's talk a little bit about how a nerve is expected to respond after surgery. Patients come to us often with nerve pain, sometimes associated with numbness and weakness. And oftentimes it's related to a pinched nerve in the neck or in the low back or elsewhere in the body. One of the main indications for surgery is to decompress a nerve. How does the nerve respond to that, and what are some things that can happen that you should be aware of? When we go in and decompress a nerve, the most reliable symptom to improve is the radicular pain, and it's usually the first symptom to improve. So if a patient comes in, they have severe arm pain, and we decompress the nerve, that pain will usually resolve fairly soon after surgery. Numbness is all over the place. Sometimes numbness gets better right away. Usually it does not. And sometimes numbness does not completely improve, even though we've completely decompressed a nerve. So if you have had surgery and you still have some residual numbness, that is probably normal and not something to be extra worried about. Weakness is a little bit the same way. If a patient has surgery and before surgery they have weakness in their foot, for example, or in their shoulder or other muscle, usually the weakness will improve, but not right away. It usually takes time. Some cases, the weakness never gets better or a partial recovery is made. We always want to make sure that we've done an adequate job with surgery, that the nerve is completely freed up, and occasionally we'll go back in and do more. However, persistent numbness and weakness is probably related to an injury to the nerve from the original pathology, and sometimes nerves don't completely heal after surgery. One final scenario that is very frustrating is sometimes we'll have a pinched nerve and we go in and we decompress the nerve and look at it, there's no pressure on it. And the patient's symptoms are persistent and even worse after surgery. We'll check an MRI and we'll note that the nerve is free, there's no pressure on it, but the symptoms are still aggravated and bothersome. I think in this case, there's a few different explanations for this. One is a nerve injury can be painful and just not heal. Another is if a nerve is pinched, especially for a long period of time, and all of a sudden it's not pinched anymore, there is increased blood flow to that area and the nerve can get swollen and irritated. In that situation, usually the symptoms flare up after surgery and then they resolve over time. I think that it can be frustrating though for the surgeon and the patient in the case of their symptoms are worse after surgery. In some cases, a patient feels better for a while and then the symptoms recur. If it's been a disc surgery in the lumbar spine, we are usually looking for a recurrent disc herniation because that happens about 8 to 10% of the time. If a nerve it has permanent injury and is still painful despite surgery, spinal cord stimulation can be a good option for patients. So in summary, the preoperative symptoms have a direct relationship to how the nerve functions after surgery. Pain usually improves reliably. Numbness and weakness are somewhat variable and usually will improve, maybe not all the way, and it's somewhat dependent on how much injury there was to the nerve in the first place. Unfortunately, in some cases, a nerve injury can occur from the underlying pathology, and the patient can have a frustratingly poor outcome even despite surgical intervention. And we try our best to understand that situation and look for alternatives such as spinal cord stimulation for treatment.